Well, I think there would be no dentistry as modern dentistry if we don't have composites. I mean, direct composites would be your go-to material for restoring teeth, for treating decay, so many different options. I mean, we wouldn't be a real dentist without a direct composite material. Yeah, well, for sure there is a lot of benefit in stock that you need to have in your practice. So I sometimes have beautiful kids with all different kind of colors, and when my assistant then goes cleaning the room, and she does it every once in a while, she checks the expire dates of all the composite brands, and it's always those colors that you are not often using, like an A4 or an A3.5, that then expires. And when it expires, you cannot use it anymore, so you need to throw it away. And I think that's not good for the budget. That's also not good for the environment, and it's just a waste of material. So when you can put it down all to one shade, it saves you economically. So economic-wise, but also environmental-wise, it would be the better option. Yeah, I think there are different composites for every indication. So each indication can need a different composite. For example, if you would do an aesthetic case, you're looking for a composite with filler particles that are very easy to polish. And if you're using composite in a case with a lot of tooth wear, you're looking for a very strong composite material. So with filler particles that might be a little bit stronger or a little bit thicker, for example. So I would not say there is a one fits it all. It really depends on the situation where you use which composites. And overall, there can be like an 80% go-to composite, but I prefer always to have for those 20% of more, how would you say, exemptions, to have a different composite for that. Well, a composite for sure should be easy to manipulate and should be easy to apply. So there are different things. When a composite is very, very stiff, for example, you want to adapt it to the matrix, you can create some voids in there, because when it's not soft enough and you apply not enough pressure, for example, or you do not pay enough attention, you can create voids between the matrix and the composite and the tooth. And that will be, yeah, that will be a reason for secondary decay, for example. So you want it to be very smoothly adapting. That's important. Great handability or easy adaptability with your instrument. So it does not need to stick, for example, to your instrument. That's important. And it should be easy to expel from the compute. So when you apply it, it goes pretty smooth. Well, one shade composites, I already use it quite some time. I think it's for more than 4 years or 5 years even that I use one shade composites. And specifically now the Transcend composite by Ultradent, I've been using it for I think 2 months now, so not that long yet. But still enough, I think, to get a feeling with the material and to see how it works in daily practice. I use Transcend different indications. I tried it first in the posterior region just to see how the material works and how well it functions, or how well it recaptures the shape, so it actually has the chameleon effect, so to say. And then when it worked out very well, I also started it for the anterior teeth, because I really like the way the color system works. I mean, you do not need to use a blocker, for example, but you can rely more on different colors there, still within the system. But still, if you're using a new composite system, always try it out, see how it works, because every composite system has its own benefits, but also its own instructions, so to say. So you need to know how to work with the material before you're using it in your most highly aesthetic cases, for example. For me personally, I always like a layering technique. Even with posteriors, I like to reshape the enamel with enamel and the dentin more with the dentin shade. So for example, with the Transcend, you have the enamel shades and the dentin shades, and for me that works perfectly. Of course, in posterior restorations, you can also go with a universal shade. I mean, that's not a problem at all. For the anteriors, I really like to use a dual shade system. So that's a multi-layer, and it's not a multi-layer, but it's a dual layer. And then you can use the enamel and dentin shade. And I think with including the dentin shade, you do not need the blocker. I think that's one of the great benefits of the system. So you can still switch a little bit with the color of the dentin, therefore creating beautiful anterior restorations. Well, the advantages are that when you would need a separate blocker, uh, you need that to block translucency of the material. So that kept me already thinking, why not using a dentin shade? Because actually a dentin shade also blocks the translucency of the material. And with a dentin shade, you can even switch colors a little bit more. So you are more in control of the final color of the restoration. So therefore, I think you need a blocker to block the translucency of the material, because otherwise your restoration ends up too grayish. But when using a dentin shade, you can even vary from the amount of warmth you want to have in your restoration. So you could use an A1, for example, if you want it to be light, or you could use an A2 or A3 dentin shade. And I think that the benefit of that is that you are more in control of the final color of your restoration. Yeah, I think the aesthetic result and the polishability are very, very good. It's easy to polish. Yeah, well, the end results, you will see it when you use it. But when you start polishing it, just need just a spiral. I like to use spiral, diamond impregnated spirals. And when you just use a medium and a fine, it already shines. Well, you don't need to do anything else than that. So it's easy to handle, and it's also easy to polish, particularly easy to polish. Yeah, for me, I would just follow a normal composite recipe. So just do etch, prime, bond, apply matrix system. You apply the composite, and what I found is that the material is pretty easy to manipulate, and it's also not too hard, but just soft, so it easily fills up the voids with the matrix. So you don't have the problem of what I previously described, that the material is too rigid or too hard, that you end up with some voids between the tooth and the material. And here the material is just soft enough that when you apply it and you press it a little bit, it already adapts very well to the matrix. And that's what I really like about the material. Well, it changes for sure when you go with the universal shades, for example. It definitely changes the way you need to buy composite, the way you have your stock organized, and the amount of composite that you will throw away because it expires. And I think that's a very big benefit.